Good afternoon, folks. Now, discussion B deals with the widening health gap that people face at the end of life in the U.S. Okay, so we're going to discuss that for B. So please join me for today's discussion B. Here we go. Based on the article content or context, this headline highlights a growing and troubling disparity in the US. People are living longer but not necessarily healthier lives, especially in their later years. Here's what the data shows. Global trend between 2000 and 2019. Global life expectancy increased by 6.5 years, but the number of years lived without disability or disease, known as health health adjusted lifespan or life expectancy, rose only 5.4 years. That means people worldwide are spending more time burdened by poor health. Okay. U.S. Specifics. Give me 1 second. Women in the U.S. saw their life expectancy rise from 79.2 to 80.7 years, but their health adjusted life expectancy in 2019 was no better than in 2020 or 2000. Men's life expectancy rose from 74 or 74.1 to 76.3 years. Yet their health years increased by just 0.6. Implication: the U.S. shows the starkest diverse between lifespan and health span. This means many Americans live longer but spend more time dealing with disability, chronic illness, or poor health, especially toward the end of life. This gap has profound implications for how we plan care, design policy, and support aging populations. It raises urgent It raises urgent questions about about access, uh, quality, and quality of care, particularly in systems already strained by demographic shifts and chronic disease burdens. Would you like to dig into how these findings might affect policy innovation? Elder care models or smart housing strategies. That's squarely in your wheelhouse. Implications of widening health gap at end of life in the U.S. The growing gap between how long Americans live and how healthy healthful they age has uh, has wide-reaching consequences economically, ethically, and structurally. Here's how it plays out. Number one, strain on healthcare systems. Higher rates of chronic illness and disability increase demand for long-term care, rehabilitation services, and specialized geriatric support. This accelerates healthcare costs, especially for Medicare, Medicaid, and stresses providers already coping with staff shortages and burnouts. Equal equity, equity and access challenges. Vulnerable populations, especially those with lower incomes or marginalized identities, tend to suffer long periods of poor health. The gap reveals systematic inequalities in preventative care, education, housing, and nutrition reinforcement, reinforcing cycles of disadvantage. Three, policy and planning procedures. Traditional metrics like life expectancy on are no longer suffice. Health span must guide funding models, urban planning, and elder care strategies. Governments may need to reevaluate resources allocations, focusing more on improving quality of life than merely extending lifespan. Designing age ready environments. More people with more people living longer in poor health, demand will grow for memory friendly units, guys. Okay. All right. Next one. Memory friendly housing. Adaptive, adaptive technologies and socially assistive robotics. Urban and residential spaces will need to prioritize safety, autonomy, and cognitive accessibility, especially in multi generational settings. Ethical considerations. The question shifts from how long can we sustain life to how well can we support living. End of life planning, shared decision making frameworks, and palliative care models will need to evolve to reflect dignity, autonomy, and emotional resilience. This data is essentially calling for a uh, recalibration of what aging well actually means. Given your deep expertise in frailty aware care models and smart housing strategies, would you like to explore how therapeutic environments like uh, integrating mindfulness or CBT into ambient assisted living systems could help close the gap? Economic costs of the widening health gap at end of life. The growing disparity between lifespan and health span in the US isn't just a medical concern. It's a deep it's a deep economic strain that ripples across individuals individuals, health systems, and society. Here's how. Number one, increased healthcare spending. Treating chronic conditions, disabilities, and late life illnesses drives up national health expenditures, especially in medical or Medicare and Medicaid. Long term care, hospitalizations, and uh, pharmaceutical costs surge as more people live longer in poor health. Example, in 2019, US health spending reached 3.8 trillion. End of life care accounts for a significant portion of this total. To pressure on long-term care infrastructure, demand for skilled nursing, memory care units, adult daycare programs, and home health aides is skyrocketing. Many facilities must retrofit or redesign for frailty and memory friendly environments, requiring sustainable capital investments. Three, loss of productivity and informal costs. Family caregivers often reduce work hours or leave jobs to provide support, incurring lost wages and emotional burnout. These shadow costs aren't always reflected in official budgets, but represent billions in lost productivity annually. Labor market strain. Healthcare labor shortages, especially in geriatric care, uh, mean higher wages, overtime, and recruitment costs. This drives up operational budgets for hospitals, clinics, and residential care facilities. Housing and social service impact. Public housing and elder support services face higher demand for aging in place modifications, accessibility upgrades, and social programs. Community and state budgets must sketch stretch to accommodate these needs, often without proportional federal support. All of this suggests that without reform, whether through preventative care, smarter housing models, or ethical decision making frameworks, we risk an unsustainable economic trajectory. Given your expertise in memory friendly housing and smart therapeutic environments, should we explore cost benefit models for integrating technologies like socially assistive robotics or predictive behavioral systems into elder care? That could be a game changer. Specific healthcare expenditures raising raising due to the U.S. healthcare gap. The widening gap between lifespan and health span in the U.S. is driving up several key healthcare expenses. Here's a breakdown of the most affected areas. Long-term care services, nursing homes, assisted living, and home-based care are seeing soaring demand as more people acquire help with activities of daily living. Specialized service for frailty and cognitive decline, e.g., memory care units, require additional staffing and infrastructure. Pharmacological costs, pharmaceutical costs, polypharmacy, use of multiple medications is increasing common in aging populations with multiple chronic conditions. Spending on drugs for conditions like Alzheimer's, diabetes, arthritis, and cardiovascular disease is climbing rapidly. Hospital and emergency department use, frequent hospital admission and readmissions for unmanaged chronic conditions or acute episodes linked to frailty. ER visits raise due to falls, infections, and medication management and caregiver burnout. Rehabilitation and therapies. physical, occupational, and cognitive therapies, especially for post stroke care, dementia, or con- concussion recovery, are expanding in scope. Demand grows for adaptive interdisciplinary treatments that go beyond traditional medical models, preventative and diagnostic screenings. As health span lags, more screenings for chronic illnesses, mobility impairments, and cognitive decline are needed to identify issues early. These services often aren't covered uh, comprehensively in lower income groups, exacerbating discrepancies. Okay, folks, like I said, this means that older people or more older people are showing up in society than previously uh, previously said, previously mentioned. So, um, government has to um, make spaces for upcoming elderly folks. And like I said last night, um, computers don't have to be in elder care. There's no place for computerizing elderly care. With that being said, Gator Wellness, take care, folks.